Today we're going to talk about cellulitis. Cellulitis is a common, potentially serious bacterial skin infection. The affected skin appears swollen and red and is typically painful and warm for the touch. Cellulitis usually affects the skin on the lower legs, but it can occur in the face, arms, and other areas. It occurs when a crack or break in your skin allows bacteria to enter. Without treatment, the infection can spread to your lymph nodes and bloodstream and rapidly become life-threatening. It isn't usually spread from person to person. Possible signs and symptoms of cellulitis, which usually occur on the one side of the body, include red area of the skin that lid tends to expand, swelling, tenderness, pain, warmth, fever, red spots, blisters, skin dimpling, meaning the skin has a texture similar to an orange peel. It's important to identify and treat cellulitis early because the condition can spread rapidly throughout your body. Seek emergency care if you have a red, swollen, tender rash for a rash that's changing rapidly. You have a fever. See your doctor preferably that day if you have a rash that's red, swollen, tender, and warm, and it's expanding but without fever. Cellulitis occurs when bacteria, most commonly Streptococcus and Staphylococcus, enter through a crack or break in your skin. The incidence of a more serious Staphylococcus infection called methicillin-resistant Staphylococcus aureus is increasing. Although cellulitis can occur anywhere in your body, the most common location is the lower leg. Bacteria are most likely to enter disrupted areas of skin, such as where you've had recent surgery, cuts, puncture wounds, or an ulcer, athlete's foot, or dermatitis. Animal bites can cause cellulitis. Bacteria can also enter through areas of dry, flaky skin or swollen skin. Several factors put you at increased risk of cellulitis, such as injury. Any cut, fracture, burn, or scrape giving bacteria an entry point, weakened immune system, conditions that weaken your immune system, such as diabetes, leukemia, and HIV or AIDS, leave you more susceptible to infections. Certain medications also can weaken your immune system. Skin conditions, such as eczema, athlete's foot, and shingles can cause breaks in the skin, which give bacteria an entry point. And shingles is a viral infection that causes a painful rash. Chronic swelling of your arms or legs. This condition sometimes follows surgery. History of cellulitis. Having had cellulitis before makes it prone to develop it again. Obesity. Being overweight or obese increase your risk of developing cellulitis. Recurrent episodes of cellulitis may damage the lymphatic drainage system that cause chronic swelling of the affected limb. Rarely, the infection can spread to the deep layer of tissue called the facial lining. Necrotizing fasciitis is an example of a deep layer infection. It's an extreme emergency. Necrotizing fasciitis is an infection that results in the death of parts of the body's soft tissue. It is a severe disease that spreads rapidly.
Okay, how can you prevent cellulitis from happening? Your cellulitis occurs. If your cellulitis recurs, your doctor may recommend preventive antibiotics to help prevent cellulitis and other infections. Take these precautions when you have a skin wound. Basically, what you need to do is cover up your skin wounds, um, or try to be more sanitary towards them, because you may not know if they're there or not. Wash your wounds daily with soap and water. Do this gently as part of your normal bathing. Just sanitize the wound if you have it. Apply a protective cream or ointment um, for most surface wounds. An over-the-counter ointment, such as Vaseline, for an example, provides adequate protection. Basically protects a protective layer on the wound. Cover your wound with a bandage. This is the easiest thing that you can do when you have a wound. Watch for signs of infection. Redness, pain, and drainage all signal possible infection and the need for medical evaluation. So basically, any cut that you have is basically an entry point for bacteria to enter. So make sure that it's sanitary. You sanitize it uh, and then you cover it up and protect it from any bacteria entering is really important. Next slide. Other thing that you can do, people with diabetes and those with poor circulation need to take extra precautions to prevent skin injury. Good skincare measures include, so this is when you just don't have a wound. Um, you need to inspect your feet daily. Regularly check your feet for signs of injury. You just make sure that you don't have any wounds, and if you do, you can apply the precautions that we were talking about earlier. Moisturize your skin regularly. Lubricating your skin helps prevent cracking and peeling. Do not apply moisturizer to open sores. Um, Having dry skin is one of the things that could lead to a potential entry of bacteria. So make sure that your skin is good and moist. Is one of the things that you could do. Trim your fingernails and toenails carefully. Don't scratch yourself, basically. Protect your hands and feet. Wear appropriate footwear and gloves, especially while doing sports or certain activities. Um, Promptly treat infections on the skin surface superficial, such as athlete's foot. Superficial skin infections can easily spread from person to person. Don't wait to start treatment. So basically, what this is saying is just protect your skin, because any wound can lead to cellulitis, which is a serious disease. Next slide. Diagnosis. Your doctor will able to diagnose cellulitis by just looking at it. In some cases, blood tests help rule out other conditions. Next slide. Treatment. Cellulitis treatment usually includes a prescription oral antibiotic. It is a bacterial infection, so antibiotic does make sense. Within 3 days of starting an antibiotic, let your doctor know whether the infection is responding to treatment. You'll need to take the antibiotic for as long as your doctor directs, usually 5 to 10 days, but possibly as long as 14 days. In most cases, signs and symptoms of cellulitis disappears after a few days. You may need to be hospitalized and receive antibiotics through your veins. If the signs and symptoms don't respond to oral antibiotics, signs and symptoms are extensive, you have a high fever. Um, so yeah, if oral antibiotics are not working, you may be going to the hospitals and they put the antibiotic straight into your veins. Usually, doctors prescribe a drug that's effective against both of the viruses that can live that cellulitis includes, which is streptococcus and staphylococcus. It's important that you take the medication as directed and finish the course of medication even after you feel better. Your doctor also might recommend elevating the affected area, which may speed the recovery. Next slide. Lifestyle home remedies. Try these steps to help ease any pain and swelling. Things that you could do at home, basically, to if you have cellulitis. Um, you could do the cool cloth trick that we talked about in earlier presentations, in which just cool the wound, and it's good for your comfort. Ask your doctor to suggest an over the counter pain medication to treat pain, basically painkillers. Elevate the affected part of the body, like elevate your leg. Ask your doctor whether it might help to wear compression wraps or stockings.